So I would like to start by saying thank you very much for having me here, team. I'll just say team. And thank you very much for the great work that you have been doing. And I can assure you that if you continue to do the same with the same dedication and responsibility, you will earn my support in the coming 2 years of my term. Leaders will come and go, but you will stay to deliver the services that the Ministry of Health is mandated to deliver to all Fijians across the country. As the Director mentioned, yes, we have issues, we have challenges, we do receive complaints, but the good work that you do outnumbers the complaints that we have, and I must thank you for that once again. Again, if I, on the same light, if I may thank you for delivering quality care and service when the country was struck by T.C. Winston. I'm sure we in the West were badly affected, and you did indeed play a role with your teams in ensuring that the people who were affected by the worst cyclone to ever hit Fiji, if I may say, and Fijians are appreciated of what you did, sacrificing your own time, sacrificing your families to be of service to our people. Okay, so thank you very much. And of course, I'd also like to say a big thank you to your families. Okay, without family support, we don't go too far. And my humble plea would be for your families, your spouses, your children, your in-laws, to be with you while you are here to serve and work with the Ministry of Health. I see a lot of ladies, but I do see gentlemen. So I'll just say ladies and gentlemen, okay? As a Ministry of Health worker, especially the nursing fraternity, I did say this in the first symposium we had in the Central, that nurses are the face of my ministry. Okay, don't forget that. I mean, as supervisors, as senior management, that message must go to your subordinate as well, that nurses, you are the face of the ministry. What you do, how you maintain yourself, how you deliver the service, how you mold your team. Okay, it's very important for us to live up to the expectations that the public has from us. And I'm sure you'd agree with me that there's a lot of expectations out there from the public when it comes to the service delivery that we are mandated to do. And the theme that you have chosen, I think you must be commended for the theme that you have chosen, that quality is in the eyes and minds of the clients. We need to see things from their point of view, what the expectations are, how best we can align our services to deliver. And I would agree, I'm sure you would agree with me, that we cannot impose our own definitions of quality on those who reach to our health centers and nursing stations and hospitals to get the very service that we are supposed to give it out to them. So I'm sure this has been mentioned time and again. You've heard from your previous leaders, you've heard from your directors, and while you have been in the nursing field, you may have heard these things. Compassion is one of the most important and central ingredient of our service delivery. With compassion comes dedication, with that comes responsibility, and for the simple reason that we are dealing with whole of our society. We're not dealing with just one group of people. We deal with everybody, and for that, care and compassion should be the core values that we hold at the Ministry of Health, and especially for our nurses. Health, you would again agree that health is a very important sector, and for too long we have been faced with these chronic issues, and maybe regrouping like this, re-strategizing, you know, and the need for us to move with more vigor and enthusiasm, with more passion, is definitely going to produce positive outcomes. And it has to start with individuals, okay? And as leaders, it's very important, it is very important, I would say, that you develop a team that works under your leadership, with you as the role models and you as a mentor. What you do as leaders will be followed by those that you lead. Should you not deliver with the compassion, with the passion, with the dedication, with the responsibility that you expect from your subordinates, then we are going to fail. Okay, and as I look across the room, there are a lot of senior people, very senior people. And there must be a reason why you are entrusted with that responsibility. Okay, so it's your role to mold the juniors who are going to enter our service or who are already in our service, and sooner or later they will take over our roles as well. Nobody is indispensable. You will not be there for, I will not be here for all my life. But whatever we do, as a humble plea, whatever we do it with the heart so that we can make a difference. Not only in the lives of the people we treat, but in the lives of those who walk with us and those that we want to develop to look after the health of our nation in the future. With compassion, I think you must have heard the word empathy a lot of times, okay? Let us not, the word empathy just be a word. It should be something that should be living within us. Putting things or seeing things from others' perspective. When a patient walks into our hospital, our nurses, you as senior managers, we must empathize with it. Why do people come to the hospitals? They come to the hospitals to get well. But many a times the experiences, few experiences that people share with us, or even share with us, with you, will indicate that sometimes they go worse when they leave our hospitals. You'd agree with? Let's not deny this thing. It's happening. Even within the last 2 months of my taking over this ministry, I have also experienced this complaints. We need to take it very, very positively. If it's happening, okay, let's admit it's happening. But how do we make sure it doesn't happen? Okay, so it'll start with your leadership. And I think, director like you, I have full faith in your leadership. Okay, please don't let us down. The whole nation is looking up to us. Okay, and like I said, we will continue to provide with the support that you need. But you, more than me, know the challenges that the health sector is facing. Things are not going to change overnight. Okay, you and I may have to work hard till we reach that goal. But let us keep walking towards reaching that goal, where every patient who enters our hospital is given that service that we are mandated to do, regardless of where that person comes from, regardless of what age that person has, regardless of gender, regardless of race. We cannot have any sort of discrimination within our facilities. And as senior managers, I would request that you do not condone that. Do not condone that at all. Negligent practices from your nurses, do not condone that. Okay? Stereotype behavior, discrimination. Let's not. Let's say no to all these things, and it has to start from you. Okay? Again, there's a lot that I want to say, but I know you want to have your lunch. So the core message there was we need to uplift. We need to uplift the service delivery, and if you are doing well, continue to do so. And again, if at this point, if I may reiterate what I've just said, that all patients should be treated with respect, fairness, without any discrimination, stereotyping, or racism. Okay? Hospitals should be places which are free from any barriers. It should be based on mutual grounds of fairness, respect, equality, and dignity. And I say this because in the last 2 months, I have received concerns regarding some. I'm not going to generalize. Okay? I'm not going to generalize. When people say, what's the problem with health? I say, look, there's a lot of positive things happening in health. But the perception out there, you'd agree with me, is that Fiji's Ministry of Health is not doing what it's supposed to do. I disagree. We are doing a lot. There's a lot of positive stories. But you've got to remember, one case of negligence is going to wipe out all the good that you do. So now we must strive to walk up to our very best, at the same time reducing any cases of negligence and stuff. And again, I've said, nurses are the face of the ministry. You support your doctors, okay, in that delivery. We've also come across issues of rude behavior. I'm not here to tell you that, you know that, okay? There would be some members who think they know too much. But as senior members, it's your role to put them in place. No room for insubordination. Please do not entertain any insubordination. Because at the end of the day, the buck will fall on you, senior managers. Okay? So make your positions felt. when juniors come in, okay, when new nurses come in, of course they come up with their own ideas, but we need to make them feel adjusted to your work ethics. That's very important, okay? And certain cases like walking by and not just even communicating with patients. We do understand that nurses are stressed at times. You are pressed for time. We do understand that, but this is a profession that you have chosen. So we need to do justice to that. So again, that's where your role comes in. And when I was a teacher, they used to say teaching was a noble profession, noble calling. I think equally noble is this profession of nursing. And you and your subordinates should see it as a blessing. Yeah? You make a difference. You can save somebody's life, or you can make somebody's life a hell. So we want to save people's life. We want to make their stay in our hospitals happy. And how do we make them happy? We have to be happy ourselves. Just smile. The Fijian smile. We are known. Come on. We are known. No matter how tired you may be, I think we all can give our patients a nice smile when they come in. Pat them on the shoulder and say, all will be well. Just by doing that kind touch, that attention that you give to the sickly that come to our hospital is enough. I do get complaints, people are on their phones not attending. I do get complaints that while attending to a patient, the phone keeps ringing. So I believe you have your own systems where the phones must be kept, put on silent mode and stuff like that. So simple things like that. I even received complaints where they asked water and they were not given water. Come on. You chose to be a nurse. Nightingales. Get your feet moving, go to the nearest step, get a glass. Here, or whatever you call, madam, there's this little bit of water for you. Simple things in life. Okay, I think we are all nurses, eh? We are all nurses. All women are nurses. All men are nurses. DHR will tell you. Somebody gets sick, what do? You care, eh? So let's care for those patients that come to our hospital as our own. I'm sure you wouldn't like your relative, your father, your mother, your kid to be treated any differently. If all of us can have that value in us, who we are treating, who we are attending to is somebody's son, is somebody's father, is somebody's mother, is somebody's child. And let us do all within our means, okay? And again, as senior managers, when complaints do come to you, please do not be too defensive. Do not be too defensive. I know you have processes in place, you do your investigations, and if need be, if your nurses need to be counseled, please do so. Okay? If only we are to move forward. Otherwise, year in, year out, day in, day out, we will continue to be blamed for that. You less, me more. Okay? So, that's my appeal to you. Our teamwork is very important. The need for us to work together is very important. Right? I may be giving this media statement and stuff, but it's all based on what you do. So the credit goes to you. Okay? In my previous ministry, they used to say, oh, you're the most popular minister. I said, no. It's because of what the staff does. It's because of what the team does. Right? So if I say something, it's because of us. Okay? And again, we should not allow these complaints that come to us to affect our work. If there is a complaint, let's deal with it and move on. Otherwise, it's going to affect your nurses too. So that's important. And there's something else that I'd like to request you for that. Information that patients seek, please give it to them. Many a times, they're not told what is wrong, why they are being admitted. That information sharing is also important, because not knowing what is wrong with the loved one or themselves creates, I think, extra stress and pressure. So they give us a call. Oh, we are sitting here in this ward, but we don't know what's wrong with my father. So when we call, you give the information. Give it to the people. Share the information. Say, okay, how serious is it? No, it's okay. We'll just keep him overnight and then he should be fine. That's the reassurance that people need. Just that human touch that we are talking about. Okay? You may be a nurse. Go out that extra mile. Go seek assistance from the doctor. Doc, this family wants to know what is wrong. Of course, they have a right to know. So tell them to ease off their problems. And the workshop, I'm sure, is going to be quite an sort of a refresher, because you've been in the system for long. I'm sure you're not going to learn anything new. It's just trying to refresh. So, I mean, we will blame it on the years we spend in a system. And as we need to, our brains get rusted, so we really need to come together and regroup, energize, and go back with this new passion to work. And looking at you, see, look how many ladies we have here. I think we need to put our hands together for all these ladies who are doing a good job. And there's a reason why we women are so good at this. Because we have a heart, We have a heart that feels. And they'll say, oh, women cry too often, men don't cry because men are strong. VHR, would you agree with us? We women have more compassion. We can feel for the other's pain. And that's why probably you are in this position. And hats off to all the women in the room. Okay? You truly and rightly deserve where you are. So please don't let me down and don't let the ministry down. Okay? We may have our differences. You may have your political affiliations. Let's talk it straight. But there's no room for this in this ministry. We are going to serve everybody regardless of who we are, where we come from, what culture we belong to, what race we belong to. No room for that in Ministry of Health. We're dealing with people, we're dealing with life and death. One mistake on our part can be disastrous. For us, for you, it might be a patient who's lost his life. For the family, it may be the loss of a breadwinner. And you can imagine the other repercussions our actions can have. So, humble plea, please get your nurses, new ones, to seek for advice if they are not sure. Patients are not there for trial and error. If you don't know something, there's no harm in asking. And this is what this workshop should be teaching you. Regrouping and finding out new ways of dealing with the issues that are presented within your facilities. Okay? And again, if the message doesn't go out, then workshops like this are in futility. It's no use coming and meeting together, having a good time and going. We spend a lot of money on this. Okay? The money could be utilized elsewhere, but I'm sure when you go back, you're going to go back to your team with shared experiences, shared best practices that is going to take our ministry to another level. Okay? Another thing, issues that come to us is about cleanliness and hygiene. Hospitals are supposed to be the place where hygiene and cleanliness should be up here. And whose responsibility is that? You will say, well, we have cleaners to do that. We pay our cleaners, we pay our gardeners, we have our people doing all this stuff. But as senior people within the facilities, it is your responsibility to see, okay, that the washrooms are kept clean, okay, the floors are kept clean, the linen is clean. Because if they are not there, then the comfort levels of our patients are definitely going to be low. So please do not compromise on cleanliness as well. Keep the hospitals as we keep our own homes, okay? And and I'm sure with all that we will definitely have impact on our service delivery. And finally, I'd like to leave each one of you with the fact that you need to have ownership of your facilities. You need to own Ministry of Health. It's not mine. It's not the Fijian government. Okay? It's not DHR's. It's not yours alone. It is ours. Let us go back and say, look, Ministry of Health is mine. This facility, I'm going to treat it. I'm going to own this facility and do everything with the powers and the responsibilities vested in you to make it the best facility around the country, to make it the best experiences for those that are going to enter your facility. Okay? And then, of course, like I said, we will continue to provide that environment and the support that you need. And for some of us, we think it's a job. Some of us are just too task-oriented. It's a task. This is my shift. Okay, I'm taking this over. This I'm going to do from 3 to 10 or 11. And after that, I'm done. It doesn't have to be like that. Okay? Just think if you did not have this job. I mean, let's go to that level. I didn't want to go there. You need to be loyal to your job, right? This is the job that puts food on this is the job that puts food on my table, and this is the job that puts food on your table. The welfare of our families depend. The lifestyle that we lead, the privileges that we have, the luxuries that we have comes from the job or the position that you hold. Don't let go of that easily because you are not loyal to your job. Be loyal to your employer. Be loyal. Okay? Whatever you do should be in the best interest of the very people that we are going to serve. And these are our patients. And again, if I may say, you have huge responsibilities on your shoulders. Women have small shoulders, but we have huge responsibilities on our shoulders. And that is to see that we take the ministry, we take the services in the right direction. Okay? You know more about nursing than I. You know about injections, you know about medicines. Okay? That is your job, and I will let you do that. But we are here to provide guidance to you. Okay? And please do not be too territorial to share your success stories. This is my facility. I'm not going to share this. So if there's a facility that needs something from you, say, no, this is mine. Okay? It's happening. And that was happening when we were dealing with this drug shortages. I was told that facilities would not share. And that's where territoriality comes in. It's one. Ministry of Health is one. You are divided with facilities and staff and personals. But we are still one. Okay? So don't be too territorial. Please share your expertise. Share your best practices. Share your problems as well and see if you can find solutions. There's no harm in saying, look, I don't know how to deal with this. And seek assistance from somebody else more senior than you. And there's no harm in listening to juniors as well. You know that, right? There's no harm in that. It doesn't threaten your leadership. Actually, it makes you a better leader when you listen to others and then use those experiences to make a decision that's in the best interest of your client or your system. And DHR, I think, did you mention to them we are trying our best to fill in the nursing positions? Okay. So hopefully that is done. When are we looking at? Jan 2017. Hopefully that would be a relief. Okay, so we can get more nurses to assist you in your work. And coming back to the theme, if I may conclude by saying with this phrase, and I quote, the best mirror to tell of the quality of our service is the patients who come to us. Their families alike will write on their hearts the service that was delivered to them. Should we fall short in our service delivery, and should the experience, rather than being a joy, become a nightmare, they will also remember that. They will remember the face of the nurse or the doctor who served them with rudeness. They will remember that. But they will also remember the hand or the words that soothed them, took them out of their misery, and gave them a better day. So that's in the eye of the beholder. The beauty lies in the eye of the beholder. So it's basically that. From their experiences, we will be able to understand how good our services are. So it is vital, ladies and gentlemen, that our Fijian nurses alike reclaim the nightingale spirit. Okay? We need to be nightingales. And it is that compassionate heart that has the fire that burns to bring caring love to the sick and the needy, and never lose an opportunity to be in service of your fellow Fijians. Never lose that opportunity to serve with compassion. Never lose that opportunity to be a good role model to those that will come after you. That's very important, especially for our younger generation. Encourage more people to join this profession, as this is very important. Director of Nursing will talk about how we are losing nurses too. Okay? That's an issue that we'll continue to face. Like, I'm sure it's because our nurses are so good that other countries cannot wait to grab them. So I will not talk more about the DHR, the job evaluation exercise that's being done. I think we'll have experts tell you on that. But there's some good things coming along, and we will try to tell you as and when we go, as things are confirmed. News will come to you. But at this point, I think this issue must have also been mentioned to you for the last 2 weeks. We are trying to create more awareness on antimicrobial resistance. Talk to your patients about that. Simply, when doctors write prescriptions, it's very important that the prescription is communicated with the patient. Okay? And if you have chance to talk to your patients about antimicrobial resistance, please do tell them about the role of antibiotics. Okay? It's very important that they know how antibiotics are to be used. Okay? Overuse and underuse and misuse, is creating a lot of issues for us. So we are trying to create more awareness about that. So if you have patients who are taking antibiotics, please tell them to complete the full dose. Simple things. If that's your antibiotic, it's yours. Complete it. Do not share it. That's very important. Not that I get, I got an amoxicillin for a flu I had, and then my mother gets flu, and she, okay, you can have my antibiotics. I mean, that's the practice in the home. So the right use of antibiotics, again, becomes our responsibility. We need to communicate it. So, okay, this is yours. Please, finish this dose. You cannot have any spare antibiotics lying around, because whatever the doctor gives you is meant to be used by you. Your uncle or your grandfather cannot share that. So, and you cannot keep it for later use. So simple information like that, I think you can communicate through your facilities and your contact with the people. And yeah, basically that. I know you're all ready to go for lunch. Do emphasize on the need for us to live healthy lifestyles to combat NCDs. Again, very important for those of you going out to the communities. Remember the message we need to take across: wellness, well-being, health is everybody's responsibilities. It's everybody's responsibilities, and it can start from our homes, our schools. We are going to vigorously follow the school health policy from next year to ensure that school canteens comply to healthy guidelines, so our children eat healthy. But it cannot be only confined to schools. It has to start from the kitchens that we have within our own homes. It has to start from the backyard garden. Simple things that don't cost much. It has to start with the choices we make on our shopping list. This or that. Am I going to buy this? Am I going to buy that? I'm going to go back home and get some fresh fruits and vegetables from my garden and prepare my family's dinner or breakfast. Simple things like that. Okay? Then only are we going to make any difference, people. Otherwise, if you look at the trends of health issues coming up, it's going to accelerate. And you and I have a very important role to maintain the health of our nation. And it can start small. For those of you who go out to the communities, it's very important you target mothers. Because we are responsible for what we cook. We are responsible for what our children take to school. If we wake up late, do we just give them noodles or something or leftovers? No. We need to be very serious about the health of our children. These diseases are now getting up to our kids too. And so as mothers, as nurses, as responsible citizens, let's do our part and promote healthy living. Very important. Okay? We all can be champions of that in the walk that we do. Because the walk that your small shoulders has is far too big. And together we will be able to handle that. We may not change the world, we may not change whole of Fiji, but we can change our own communities, we can change our own families, we can change our own children. And I'm sure we will head in the right direction. So with that words, I know we are all ready to go for some healthy lunch if I may say. But thank you very much, and I wish you all the very best in your further deliberations. May you have safe travels back home, and God bless you.
Congratulations.